Good morning to all. This is Subhashri from the Department of Computer Science, SNSCT. So here we are going to see about human disease, that is of cancer. So what is cancer? It's a disease where cells grows out of control and invade, erode and destroy normal tissue. So the question here is, cancer is a large group of diseases with one thing in common. They all happen when normal cells become cancerous cells that multiply and spread. Cancer is the second most common cause of death in the US, but fewer people are dying of cancer now than 20 years ago. Early detection and innovative treatments are curing cancer and helping people with cancer life danger. At the same time, medical researchers are identifying independent risk factors linked to developing cancer to help prevent people from developing the cancers. So, what is the difference between a normal cell and a cancerous cell? So, normally cells follow instructions provided by genes. Genes set down rules for cells to follow, such as when to start and stop growing. Cancerous cells ignore the rules that normal cells follow. Normal cells divide and multiply in a controlled manner. That is, cancerous cells multiply uncontrollably, whereas they are programmed to die. That is, we can call it as apoptosis. Cancerous is more those directions. So, cells for solid organs stay put. All cancerous cells are able to move around. So the normal cells here don't grow as fast as cancerous cells. So what are the types of cancers we are going to see? So there are many different types of cancer. So bladder, breast cancer, endometrial, leukemia, pancreatic, then thyroid cancer. It will affect in the bladder. It will affect the bladder. So in the lung cancer, it will affect the lungs. So melanoma, kidney cancer, lymphoma, prostate, and the colon rectal. So prostate cancers come in the uterus or in the pelvic regions. So how does cancer start in your body? Cancer starts when a gene or several genes mutate and create cancerous cells. These cells create cancerous clusters or tumors. Cancerous cells may break away from tumors using your lymphatic system or bloodstream to travel to other areas of your body. Healthcare providers call this metastasis. For example, a tumor in your breast may spread to your lungs, making it hard for you to breathe. In some types of blood cancer, abnormal cells in your bone marrow make abnormal blood cells that multiply uncontrollably. So eventually, the abnormal cells crowd out normal blood cells too. So what are cancer symptoms? The symptoms comprises of many varieties. Cancer is a complicated disease. So you can have cancer for years without developing symptoms itself. Other times, cancer may cause noticeable symptoms that get worse very quickly. So there were common cancer symptoms which includes sudden weight loss, chronic tiredness, persistent pain, then the fever that occurs mostly at night times. The skin color will also changes into pale, particularly moles that change shape and size or new moles will develop in the areas where the cancer affects. So what causes cancer? A genetic disorder. It happens when genes that manage cell activity mutate and create abnormal cells that divide and multiply, eventually disrupting how your body works. So, what is cancer risk factors you can control? Smoking. Smoking cigarettes and cigars and using a cigarettes increases your chance of developing lung, pancreatic, esophageal, and oral cancers too. So, eating high fat or high sugar foods can increase your risk for many types of cancer. You're also more vulnerable to disease if you don't get enough exercise. So, the environment, exposure to toxins in your environment such as asbestos sheets. We are using asbestos sheets on the roof of the house, and pesticides and radon can eventually lead to cancer. So radiation exposure, ultraviolet, that is radiation from the sun, significantly increase your risk of developing skin cancer. Overexposure to radiation treatment can also be a risk factor here. So how can I reduce my risk of developing cancer? Your risk by changing some of your lifestyle, which includes if you smoke or use tobacco, or you have to try to stop it. Ask a healthcare provider about smoking cessation programs that can help you quit tobacco. Follow a diet plan that's healthy for you. If you want help managing your weight, ask a healthcare provider about nutritional guidance and weight management programs. So what are the other things? Avoid toxins including asbestos, radons, pesticides. Everything is a toxin that we are facing in a day-to-day life. So protect yourself against sun damage. Have regular cancer screenings. So what are the 4 stages of cancer? So here are the 4 stages. Stage 1 comprises of a localized to a small area and hasn't spread to lymph nodes or other tissues. Stage 2 comprises of cancer has grown but it hasn't spread. So stage 3, the cancer has grown larger and has possibly spread to lymphatic nodes or other tissues. What is stage 4? and the cancer has spread to other organs or areas of your body, this is also referred to as metastatic or advanced cancer. So, how the cancer stage is determined. Healthcare providers use cancer staging systems to plan treatment and develop a prognosis or expected outcome. This is the most widely used cancer staging system, stands for primary tumor. The second one is which stands for lymph nodes and indicates whether a tumor has spread to your lymph nodes or not. Stands for metastasis when cancer spreads. So, what do healthcare providers treat cancer? Then, how do they do them? Healthcare providers may use several different treatments, sometimes combining treatments based on your situation. Common cancer treatments include very common cancer treatments here is chemotherapy. So, what is a chemotherapy? It is one of the most common cancer treatments. It uses powerful drugs to destroy cancer cells. You may receive chemotherapy in pill form. Pill is in the form of a tablet. So, in some cases, providers may be able to direct chemotherapy to the specific area affected. So, radiation therapy, this is the next level. This treatment kills cancer cells with high dosages of radiation. Your healthcare provider may combine radiation therapy and chemotherapy both during the treatment. Then it comes to the surgery. Cancerous tumors that haven't spread may be removed with surgery. Your healthcare provider may recommend therapy. This treatment combines surgery with chemotherapy or radiation to shrink a tumor before surgery or to kill cancer cells that may remain after surgery. So, the conclusion here will be cancer is a second leading cause of death following heart disease. One should care about its prevention before the occurrence of the disease by various examinations, and if disease already exists, then one should go for its regular treatment, regular diagnosis, regular clinical findings is mandatory for eradicating cancer cells. Recent treatment mainly includes radiation therapy, cell-based immunotherapy, generotherapy, chemotherapy, chemotherapy are most widely used methods used for treatment of various types of cancers. And thank you.